obstructive or central sleep apnea are very prevalent, in particular OSA, and they do overlap with airway diseases. There is some correlation or epidemiologic data that shows that your asthma or your COPD is much worse if you have obstructive sleep apnea that's not being treated. And so it's incredibly important to identify sleep apnea in general, let alone in the setting of airway disease, where it becomes even more important. And so what we do in clinic is, if we have a patient who we suspect has sleep apnea, we work them up aggressively and we treat it, and we make sure that they're compliant, because it makes treating their asthma and COPD, at least anecdotally, much easier. And there's literature to support that as well. The pathophysiological mechanisms are interesting, and they probably, and again, probably in quotations, because we haven't worked that out yet, are related to periods of hypoxemia when patients are asleep, and that can trigger all kinds of inflammatory pathways in the body systemically, let alone in the lung, and that may actually make your asthma much worse or your COPD much worse in the daytime waking hours. So that's one reasonable hypothesis. The older you are, and if you have COPD or overlap, the more likely you are to have cardiovascular comorbidities, hypertension, coronary disease, history of stroke, etc. So that aspect seems to correlate more with age and more with COPD, or even overlap. Okay, and when we looked in our clinic, we saw the same thing. So if you have obstructive sleep apnea, that in and of itself increases your risk of hypertension and potential negative cardiovascular outcomes, like heart failure, sudden death, things like that. So those comorbidities do go together. If you just have asthma, it's less prevalent, but it can be there as well, especially if there's obesity too with asthma. So a lot of these comorbidities overlap. But if you've identified patients as having COPD, if they're older, then the risk of cardiovascular comorbidities is actually, or at least the prevalence is quite high, much higher.